What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. Very excited to have on Dr. Matt Williams. He is a clinic director at PT Pros in Kentucky. And for those of you who may or may not be aware of this, we just hosted one of our Blueprints courses. So Anthony and Mike went out and taught our Blueprints course to predominantly a PT Pros team of professionals, wide variety of different clinicians. As Matt and I were just talking about, people of varying experience levels, varying exposure to sports and performance rehab. But before diving into some of the details, Matt, just for the listeners there, talk to us a little bit about PT Pros, kind of how your organization is set up, and then we'll get into all of the various things that you kind of have your hands in at this point.
Absolutely. So PT Pros is actually, it's been in practice for 40 years now. It actually started in a little town called Barberville, Kentucky. It's a really small rural community. We've now expanded to 13 clinics across the state of Kentucky. And so I currently serve as a clinic director at our Danville location. So for anyone who's familiar with the Central Kentucky area, Lexington, Kentucky is, I guess, kind of our metro hub, essentially. And then we're about 30 miles south, give or take, from Lexington. And so I've been the clinic director there for almost 2 years now. Our clinic opened in November of 2019. As you can imagine, you got the holiday lull. So that was an interesting time for us to be opening, trying to gain some momentum and some traction. You're rolling into spring of 2020, pandemic happens, major shutdown. So we actually did not work from about the middle of March into the middle of May. So that was an interesting time for us. But long story short, by the grace of God, we've been doing really, really well. I currently have another full-time clinician hired at our Danville location. We also have 2 part-time therapists there as well. And we actually opened a location in Lexington, Kentucky, being our 12th location, and now Williamsburg, Kentucky, being our 13th location at the University of the Cumberlands. And so we're really excited. Growth is good. As long as it's intentional growth, I should probably clarify that. So our clinics are doing really, really well. And we're really excited about what's new on the horizon for the company moving forward.
That's awesome, man. I'm really happy to hear that. I think the pandemic, and without talking about and going down this route too much, was a tremendous period of reflection. It was a time period to really figure out where your potential problem areas or even areas for opportunity, as you mentioned. And I echo your sentiments in that I feel like we're coming out on the back end in a much better place. And I'm very, very optimistic about our future. But with that being said, I mean, back to kind of where you are and the space that you're in, I always think of Big Blue, right? University of Kentucky. You are involved there as an adjunct professor in an intro to performance rehab course. So this material and this world is something that you're obviously very, very passionate about. At what point did you see PT as more than maybe just the traditional sense? And what have your steps kind of been to this point where not only you're a clinic director, you're intro performance rehab, and you're training athletes on the side at a variety of different experience and age levels?
So I think a lot of that was rooted just in my experience as a patient. And I don't want this to seem like I'm throwing the clinicians I worked with under the bus, but they were phenomenal people. But I think one thing that I figured out on this side of it now is we have to extend a lot more grace as far as what are people willing to expose themselves to, and then how are they implementing those resources in the clinical environment? So for me as an athlete, I'll just be completely candid with you. A lot of the rehab I received was just modalities, your basic, stretches, table stuff. But in the back of my mind, I intuitively had to wrestle with okay, but how is this going to help me get back to, the basketball court or back on the track or, whatever the case may be, back on the football field. And so even then, those seeds were already being planted. And then I think it just amplified even more with each phase of my life. And so, then I go into physical therapy school in some traditional outpatient environments. But I think where it really shifted, or probably what was the catalyst, was I spent some time in Columbus, Ohio, and my clinic director there actually saw a lot of CrossFit athletes. And so I'll never forget this. We had a client come in with low back pain. He had strained at deadlifting. You know, kind of know how it is when you have a student, okay, hey, what are you thinking? What do we need to take a look at today? Where do you want to start out with treatment? And so, you know, I'll spitball the textbook classic academic answer of like, oh yeah, we'll do some pelvic tilts and, you know, we'll do some dead bugs. And not that those things are inherently wrong, but she's like, okay, but do you not want to see him deadlift? And I was like, are we allowed to do that? And so she and I got to have a very fruitful and productive conversation unpacking, you know, again, and kind of not to like be super cliche here, but how do we bridge that gap between rehab and performance? So, hey, I think it's great that you're thinking along the rehab side of the spectrum, but this is a high level athlete that's going to need to get back to competing at a very high level. So we have to be intentional about these things and play a part throughout this journey. And so for me, I think that was the catalyst and how I wanted to do things differently moving forward. So super long story short, a classmate of mine, Jordan Barker, he's practicing up at Beacon Orthopedics right now in the Northern Kentucky, Cincinnati area. He and I had that same passion and conviction once he came back from his internship with Exos about how could we possibly do things differently once we graduated. And so the thing we did notice too, that there was also the gap between the classroom and the clinic. So I think a lot of times students can get frustrated that they're not being exposed to this content, but in reality it's the program's job to make sure you're safe, and it's the program's job to make sure that you're able to pass your board exam. They're not inherently responsible for making sure you're getting exposed to this content and this material. So we wanted to be a part of the solution instead of just reinforcing the problem. And so he and I approached the program about, hey, you know, could we possibly offer an elective course for your students, probably third-year students who know they want to be in this space, just to better prepare them for whatever clinical internships they have, whether it's R2P or, you know, maybe it's one of the Onward Physio facilities or any other performance-based rehab facility in the country, but then also to better prepare them for actual clinical practice once they were making that transition from the classroom to the clinic. So long story short, been doing it for 3 years now. I'm excited that I have been invited back for a fourth year. So I'll have my next cohort in January of 2022.
That's awesome. And before I dive in a little bit further here, I'm going to put you on the spot.
Yeah.
OH.
I-O.
There you go. All right. You might not like it, but I'm a Buckeye. I don't know if you knew it or not. So
okay. I didn't know that. So I love Columbus, by the way. It's probably one of my favorite cities. Yeah.
Yep. It's a great city. Feel blessed to have been there. That was actually where, PT, I was first exposed to the profession. I played lacrosse in college, got hurt. Nonetheless, had an amazing experience with the staff there. Just the integration of ATC, PT, strength coach, and my sport coach would not be where I am today without getting hurt there and having an amazing experience with their sports medicine staff. But for you, I mean, you brought up CrossFit. I think that's something that sometimes is, one of these weird topics for people where they're like, don't do CrossFit. CrossFit's stupid, yada, yada, yada. Regardless, CrossFit's here to stay. I mean, I think we both can agree with that.
Right.
And as you mentioned, trying not to put ourselves in a position where if we're working with this population or really any population in general, that we're not reverting to too low level of activities. It's like if there's a spectrum in terms of where that individual is, let's say CrossFit is their normal like 100, we don't need to take them all the way down to 10 or 20. We need to figure exactly how low, and what we'll commonly refer to as the entry point. So where is the entry point in which we can still do some things that are therapeutic, but also not counterproductive? Do you have any thoughts on there? I mean, anything that comes to mind and some things that maybe you find yourself having conversations with your students as well?
Absolutely. The first thing that comes to mind, and this is both in my role as a clinical instructor and as an adjunct professor, is it's a terrible analogy. My wife's an educator, so sometimes she'll give me a hard time about my analogies. But what I say is if you think of just like the subject of math in school. So we obviously start with, addition, subtraction, multiplication, division. We work up to algebra. You work up from algebra to trig to calculus. Sometimes, kind of to your point, you have an elite level athlete. So they're kind of that calculus level. Well, they may not need to regress all the way back to the addition and subtraction phase. We may need to just bump it back a step to that trigonometry phase. And so is that our entry point? I think a lot of times, even as just rehab providers, at least some of the athletes I see, the anxiety or the pressure they're feeling is, okay, if I'm seeing you, that means there's something inherently wrong and you're going to tell me to stop doing things. And so what we're trying to navigate is, okay, hey, you're here post-op ACL. your arms still work. Let's just still keep working your upper body. I still want to keep you in the weight room and help you feel like you're involved with the team, because we can get so focused on the physiological and the biological side of things that we forget the psychological and the social. And so I think, and again, I don't want to go down the whole rabbit hole of the BPS model versus the biomechanical model and all of that, but I think there is something to be said to make sure that when we are addressing these needs or these deficits with our athletes, even with any of our clientele in general, that it's more of a holistic approach, and we're really weighing in all these different buckets or factors that are playing into who they are as an individual. So for me, I definitely resonate with the entry point. Just as a practical example, even looking like our older adult clientele, hey, if they're having issues picking up things off the ground, okay, do you place a kettlebell on an elevated surface and then you eventually work down to the ground instead of saying, hey, we're just not going to have you pick up anything altogether? If that, was something that was important to them, then we have to be intentional with integrating this in some way, shape, form, or fashion as part of their rehab regimen before we can say with full confidence on their graduation day, hey, I think we've checked off every box. I think we've got you about as resilient as we can be. And I feel comfortable and confident letting you go and tackling this on your own now.
I don't know if I could have said that much better myself, but I appreciate you also mentioning BPS. Obviously, you have your Level Up shirt on right now, that being something that kind of underlies, right, some of the messaging and some of the things that are taught through that program. You've gone through that as a mentee and mentor, and you're clearly somebody that's just passionate about not only educating yourself, but educating others. Mm-hmm. You've mentioned that you're working on getting a little bit more involved in the academia side of our profession. Is there anything in particular that you see as a space that you want to push into?
Yeah, I think I'm starting to figure out that, I guess, more of my niche or I guess lane or path is kind of steering more towards either clinical education or just therapeutic exercise in general, or some combination of the two. So again, and it's kind of one of those things too, if there's anyone out there who's kind of struggling with, what space am I supposed to be in? Where do I really fit in? Number one, I would just encourage you to not get so caught up in what everyone else is doing, because I think sometimes that can be really discouraging of like, hey, this person's only working with Division I collegiate athletes and, professional soccer players. That's what I want to do, but I'm serving in this capacity where I might not be working with that population. But again, it was me just really taking a look at, over the past almost 5 years that I've been a clinician now, to say, okay, what do I naturally gravitate towards? What affirmations have other people spoken into me that they see in me that I seem to thrive in those environments? And then what do I feel like I'm best equipped as far as like my abilities and resources that I have to serve in the spaces that I'm privileged to serve in? And so for me, it really seems like that mentoring, teaching aspect, but just figuring out how do we make clinical experiences more enriching for students, as well as just really tapping into how can we be more intentional with how we prescribe exercise in the rehab setting, and, kind of getting away from, and again, it's not to, throw 3 sets of 10 under the bus or to demonize it. There's a time and a place for that set rep scheme, but how can we be more intentional with how we program our clientele's rehab regimens when they're in the clinical setting?
Yeah. And I think, at least hearing you, I feel like you could go probably a wide variety of different ways with regards to whether or not it's UK or within the framework of PT Pros. When you say that you are a clinical instructor with PT Pros, are you typically doing one-to-one? Do you find yourself taking 2 students on? And then do you have any higher level programs also in PT Pros where some of the students can get access to higher level learning?
So traditionally, I've only taken in 1 student at a time. But last summer, I have to get my time frames right. Yes, last summer I actually took 2 students for the first time. And again, part of that was just my conviction that a lot of the feedback I was hearing from different programs within our state and across the country was that, hey, a lot of people really hesitant in taking in students right now. And I felt like our team did a really good job of having some safety and precautions in place to where we felt comfortable taking in a couple more students. And again, you and I talked about this before we hopped on here, just the space that we have is just really unique and really different. And that it could afford us that opportunity to take in more students, because again, it's one thing to just study and stew and marinate on things on paper and in a textbook or on a screen or through a slideshow, but it's a whole different thing to actually be able to implement it and to apply it in a clinical setting where your patients aren't always black and white, and you've got to get really comfortable with navigating this gray. And so I thought if there was a way that I could provide more of those opportunities for students, then I want to do that. But I also knew that probably taking in 3 or 4 wasn't the wisest idea, just in terms of being able to intentionally invest in both of the students that I did take in and not have them feel like, one of them was maybe being neglected in comparison to the other one. So that's kind of what it's looked like on a micro level. More on a macro level, not so much anything formal with PT Pros. I'm also our company's clinical education coordinator, but I do have a handful of students that I'm mentoring outside of my roles, like, anything labeled physical therapy, a couple that are trying to get into PT school, a couple that are in PT school, and then one that's a new grad. And so, again, I just thoroughly enjoy mentoring and teaching and kind of this education sphere, because if it hadn't been for people who were willing to invest in me, I wouldn't be where I'm at today. So I think the best way for me to pay it forward is to be intentional, at least in this phase of my career, to really try to reach back to whatever community spaces I've been a part of, whether it's, rural Kentucky where I grew up, or, central Kentucky where I did a lot of my undergraduate and professional learnings.
And gosh, just hearing you, obviously the passion and all the different ways that I think that you're thinking about increasing your reach and increasing your impact. I saw you write somewhere like radically investing, right, in the next generation of clinicians. Is that a Ray Dalio reference, by the way?
So I actually piggyback that off of 2 of our church leaders. That's kind of like their mantra, is the radical generation of students. So they typically use that phrasing as far as it pertains to student ministry or children's ministry or high school ministry. So I've kind of just adapted that into kind of my mindset and one of my principles and how I approach investing in the next generation of clinicians, because I really love that phrasing and how they've tied that in.
Yeah, it just made me think Ray Dalio has it's radical transparency, radical investment, a bunch of other things that he has present in his books. But you're mentioning community, you're mentioning an area where you grow up, you're mentioning impact outside of the 4 walls. What are some things that you're doing to potentially pull people to the profession? Let's talk about serving the community. Let's talk about serving people beyond just the situation in which they enter our doors, which is as a patient.
I think probably for me personally, without missing the obvious, just being a minority, I think it's finding opportunities, actively seeking them out, and accepting opportunities that may come up organically to just go back and speak, whether it's at a health fair or if they're having a healthcare panel, if it's a middle school or a high school or an undergraduate institution, because I think representation matters. And that's any race, socioeconomic background, whatever the case may be, because people just need to see that, hey, there's someone who looks like me that's at this point in their life. And I feel like I have an opportunity and a chance to do that too. And it could be somebody from a rural community. It could be someone that's African-American, Hispanic-American, any way you want to package that. But I really think representation matters. And so that's one of the ways that I try to be intentional in that aspect, is hey, if a school reaches out to me about, hey, we're having, a career fair in the spring, would you be willing to come out? Absolutely. Absolutely. I'll be one of the first people to show up for something like that. So I think that's kind of one piece to that. Probably the other one too, and again, it comes back to that investing in the next generation of clinicians. I also encourage my students to do that. Hey, if you grew up, in a rural setting or whatever the community case may be, are there opportunities for you to go and do that? So it's hey, here's one of our own who is in this profession. And if you ever needed someone to talk to or to speak with, or maybe you could mentor them, there are some really unique opportunities there on the table. And so I really try to encourage them to, hey, I know it's easier said than done, and things are very overwhelming when you first get out of school. You're just trying to keep your head above water with your caseload. But once you find your rhythms and your routines, try to intentionally look for ways to just be involved in other things outside of the 4 walls of the clinic. Another way that I've done that personally is, so my undergraduate alma mater is Center College, which is in Danville, Kentucky, which is where I practice at now, is looking at ways to serve their athletes there, because if it wasn't for the athletic training staff keeping me healthy, I wouldn't have played as long as I did my athletic career. And so me knowing some of the dynamics there as far as, how many athletic trainers they have on staff, who's full-time, who's part-time, how many student athletes they're trying to serve, they just get really overwhelmed. So what I've said was like, hey, I'll take, 2 hours out of, 1 or 2 Fridays a month just to come hang out. If you need somebody to tape ankles or do some soft tissue work or take someone through like part of their, training room regimen, I'm more than happy to do that. And so just being willing to give up some of that clinic time to invest in other ways like that. Now, obviously, that's nuanced and that's context dependent. I know for some people, they're single and they have more time to do that. Some people may be married and have a ton of kids, so they don't have the time afforded or allotted to them to do something like that. However, again, I really feel like our profession is whatever you want to make of it. If you just want to, show up at 8, go home at 5, do that Monday through Friday, and that's your speed, then that's totally okay. But if you're someone who's looking for more buckets and more avenues to be invested in, then the opportunities are out there. I think it's just a matter of us being willing to put ourselves out there, but obviously within, our abilities and giftings again, and affinities as well.
For sure. Yeah. I mean, I think that being a new grad, granted, I can't remember it as much because the years just keep going on, and I'm actually about to hit my 10-year anniversary after graduating from PT school, which sounds kind of crazy, but being connected to our team and having some younger members of our team, all of the different areas in which life is pulling at them can be very, very challenging for them to want to add layers, right? Or add whether or not it's layers of complexity or just things to do can feel very, very overwhelming and almost burdensome. But getting to what you were talking about with regards to representation, becoming more aware of some of the numbers surrounding just how representative our profession is, or the lack of representation within our profession. Numbers like, right, I think 3% of African American students are in PT school, right?
I think that's the last stat that I saw.
Yeah, something around there. And I just keep looking like upstream. And how do we get to high schools? How do we get to middle schools to ideally expose people to this profession? And I do think you said career fairs. I think of like career days, guest speaking, high school internships. We, as a result of a lot of things that went on over the course of the past year. I mean, how do we make our internship better? How do we ensure that we're not getting interns all from the same high schools? Knowing that, that if we allow 1, 2, or 3 students, say, from the same high school because they've got pushy parents or this, that, and the other, like we're going to potentially put ourselves in a situation where we're also then excluding, because you only can have a certain amount of spots from some of the other area high schools. So the high school internship has been an area, and I should say high school touch points has been something that we've been trying to unpack a little bit more, figure out what is best. And then for people who are out there who are in a position where they are attracting DPT internships, I think being a lot more strategic about reach outs, making sure that you're allocating certain slots to universities that have a more diverse DPT student population, especially for us. And I imagine you very, very similar. Like that's a pipeline to employment and people joining the team. So if we are to have a more diverse team, we need to come up with all of these different touch points at an earlier stage where people can be not just exposed to the profession of physical therapy, but be exposed to PT pros and R2P. Is there anything that you've seen kind of going on at whether it's DPT, college, high school that has potentially worked for you, or things that you're doing differently to change that pipeline into the profession?
I think for me, I've had former supervisors and colleagues and mentors that have also, what I say, it might be terrible phrasing, but it's kind of made their radars a little bit more sensitive to students who may be a quote unquote like better fit as far as like nurturing these relationships moving forward. So, a couple of guys that I'm mentoring right now are minorities. And so they were like, hey, I've gotten to know I've gotten to know this person or this young man for however long. However, I feel like I might be doing them a disservice because there are things you might be able to speak to as far as like what you've experienced both in school and outside of school as a professional now that I can't. So would you be okay if I like kind of steered them in your direction? Hey, that's totally fine. Conversely, I've done the same thing too. I've had a couple of people that kind of quote unquote started out with me. I'm like, hey, you know what? There's actually a couple of other people in my circle that I feel like might be a better fit as far as kind of like, your passions, your potential experiences, things like that. Would you be okay if I pointed you in their direction? So for me, I think I would probably say it comes back to more humility. Because I think, and again, this might be going down a rabbit hole, but sometimes we can kind of take on like this savior complex. So like I've seen it in the clinic as far as like, this is my patient and I have to be the person to get them better and all that, not having enough humility to say, hey, I've gotten you as far as I can. So even though I've been a clinician for almost 5 years, this sport isn't my wheelhouse, but my number 2 clinician, who's only been here for about 7 or 8 months, would do you a better service in getting you back to performing at a high level. I think that same principle transcends over to even just mentoring as well. Just recognizing that, hey, I don't have to be the person that like, shepherds this person into the profession and sees them all the way through until, whenever they're finished. Maybe it's just for a season. Maybe it's our responsibility or our role to take that middle schooler and to get them, more interested in science related fields for high school, or that high schooler who might be interested in healthcare, but they don't know if it's PT or OT or speech or whatever the case may be. I mean, I've actually had 2 high school students recently who, after interning with us, they were like, hey, I don't want you to be upset with me or to be angry, but I don't think PT is the right fit for me. And I think they were flabbergasted that I said, hey, I think that's fantastic. Like, that's what I want this experience to be, because again, it's a major investment on your part, both time and financially, to go do something to realize either you're doing it for the wrong reasons or it's just not the right fit. So for me, I think the humility piece is huge, but then just also being intentional with like, what direction do we steer people in, and not feeling like, hey, people or projects that we have to fix. Their relationships we're called to steward well and to invest in for a certain season, but to also have the humility to be willing to let them go when we realize that season has kind of passed.
Yeah, I mean, it's one of those things, and I obviously, you've mentioned that you are married. See the wedding ring, and I have a fiance that I will be getting married to this August. And
congrats, man.
Hey, thank you very much. A profession is not that much different than dating. You need to figure out what you don't like, and exposure being tremendous for young people. When I go and speak at career days, I'll be like, if you don't know what you want to do right now, you just need to try more things, right? Mm-hmm. And if you don't know what you like in relationships and dating, and when it comes to a life partner, you need to date and meet people. And the more that you meet people, and the more that you, figure out what you like and don't like, those are both valuable to you eventually getting to a point where you're in a situation where you have a profession that you're doing every day that you enjoy, and you're spending time with your life partner that you enjoy almost every day. But yeah, it's it can be, I think, it's awesome. I love you. Yeah, use the season of life, and it's like we're with people for periodic little seasons, and as long as we are making sure that we are allowing them to have the best experience possible, I think we're doing as much of a service to them as possible. And if they still, after that season, are not in love with the profession itself, but they took some positives and some negatives and they're moving forward, that being probably the most important thing that we could offer that person. But getting people into like healthcare, I think, would be great, because we have a lot of people that will come in and they'll go, all right, I don't like PT, but I did like this and this and this, and I think I might actually want to try this now. And then we serve as almost like that navigator for them, so to speak, where, oh, hey, all right, I know this person, reach out here, reach out here, reach out here. And then you're kind of almost, shepherding them on to somebody else in a new relationship or a new experience. Do you find yourself doing something similar?
Yes, absolutely. And I think it's an interesting parallel too. So obviously R2P and kind of myself, we both kind of resonate with principles over methods. I even see this kind of being fleshed out in this space as well. If we can help them figure out like, okay, what are your guiding principles or the things that you value the most in a profession? We've established this. So now what application does this fit best in? Is it maybe more strength and conditioning and not PT? Okay, great. I know 2 local strength coaches that would be great for you to go hang out with and to connect with. Let me get you the information and let's get you there. Because again, and it kind of ties back to the classroom as well. I tell my students this, well, even as a clinical instructor, and I know it gets pretty frustrating at times when they'll come and ask me a question and I answer their question with the question, because I'm not here to tell or teach people what to think. I want to teach you how to think. Because again, at the end of the day, we have to equip and empower the people that we've been entrusted to lead, to make decisions for themselves. And I think sometimes we don't always do the best job of that. And I've been guilty of that as well. And that's something I've had to really take a step back on is, okay, it's not my goal for you to become a carbon copy of me and do the exact same things that I would do. If we could at least agree on principles, then given the context of your situation, I'll let you flesh out those methods and those applications how you see fit. And I think that's been the biggest shift I've seen in my teaching mentoring strategies, year 1, looking into year 5 now. If that kind of makes sense. I feel like that was a little bit of a tangent, but.
No, it does. I mean, I can think of just myself just being early in my career and like wanting somebody to almost hold my hand or tell me what to do. And then if anything, just appreciate where I've gotten to at this point where, dare you say like an algorithm or things are kind of like a choose your own adventure a little bit. You're taking information in. Okay, you're at this fork in the road. I could go this way or I could go this way. Well, okay, I'm taking into account previous experience and the information that I have at hand, and I've got a certain level of certainty. And okay, I'm going to go this way. And it's a little bit fluid. If this wasn't perfect, well, I can kind of maybe go back the other direction if I need to, but you're functioning more within those guardrails instead of something that's more of like this absolute, if A, then B, then C, then D. And it's definitely, it reminds me a little bit less of like a treadmill, so to speak. I don't want to get on a treadmill with every single person that I'm with, where everything just seems very robotic and planned out. So especially appreciating the fact that human beings are incredibly complex and all of the different things that are going on with them are fluid and subject to change at any given moment. But Matt, to kind of wrap up today, I'm gonna give you a challenging question, and we're starting this new final question with you. So
okay,
all right, you can go two different ways with it if you want to. Where do you see our profession going, and or where do you see your role within the profession going over the years to come?
That's a good question. I'll actually try to answer both. I think for me personally, I've been really encouraged and hopeful more so over the past 3 years than I maybe have been when I was a student, maybe my first couple of years out. And just, number one, the number of resources that are available now for new graduates that are looking to grow, hopefully personally and professionally, but then also the quality of those resources that are out there. And again, I don't want this to seem like a shameless plug. Like obviously the content that you all put out has been very influential on me. And I've shared it with numerous people in my circles. And I think of groups like the Institute of Clinical Excellence, just to do 2 quick plugs. But I think just seeing the fact that students are now, obviously they're exposing themselves to this content, but I'm kind of seeing like this passion and this sense of urgency just to have higher convictions to want to do things better. Because I think it's one thing to like know that, okay, we know things, we know our blind spots, we know our shortcomings, we know our areas for improvement within the profession, but are we actually doing something about it? And I think that's the dividing line that I'm seeing. But I think things are now starting to shift more towards the, hey, okay, I do want to expose myself to this content to figure out how can I serve my clientele and my communities better. So I think that's the trend that I'm starting to see now that I'm really hopeful about. And then even just looking, I'll kind of use your terminology, upstream, downstream. So even looking downstream too, how many more programs and institutions are willing to invite people like myself or you or, Zach or whoever it may be to come in and say, hey, you're doing something different with this Level Up initiative. Hey, you are doing something different with exercise prescription. Would you mind to, be a guest lecturer, or would you mind to do a course? And so I think that programs are starting to identify that sense within the students too. It kind of comes back to that humility piece. They're having enough humility to allow us to come in and say, hey, okay, maybe we haven't been getting this right over the past few years. What can we do differently? For me personally, I'll just be completely candid with you. I don't see my career closing out in the clinical setting, and I could be totally wrong from now and have to eat my words, over the next 5, 10, 15, 20 years, whatever that looks like. But again, I'm starting to see my passions reside more in academia, and, I'm not sure what that looks like. I'll keep serving in the capacity that I've been given and the platforms and the opportunities I've been given. And if that snowballs into something else, then I'll willingly step into that role if and when those doors of opportunity open up. And so, again, for me, I've always kind of had this sense of urgency to just really tap into leadership. What does it mean to lead? I think it was John Maxwell that said leadership is influence. And I've kind of taken it a step further and really tapped into, okay, but that could be bad or good. So would leadership technically be positive influence? And so me kind of wrestling with, okay, what are my blind spots as a leader? You talked about the pandemic earlier. I think that 2-month window really gave me time to pause and step back from a lot of the distractions I've had to say, hey, how am I leading in my marriage? How am I leading, my students? How am I leading in the clinic? And what do I need to do differently once I get back into kind of a quote unquote normal rhythm and routine again? And how can I approach this with a different perspective and a different heart posture too? So for me, all that being said, I'm starting to see that I'm navigating more towards like academia and education. And so, whether it's still an adjunct role, a part-time role, or eventually a full-time role, I'm hoping that I'll be obedient. If that's where I'm called to serve, then that's what I'll go do, and hopefully do it at a high level.
Well, Matt, man, you have a fan in me, and I can tell you that I was excited to have this conversation today. For the people listening, something that stood out. I sent out a little form ahead of time, and one of the things that he said makes him unique and makes him tick is his passion and conviction to lead at a high level in all aspects of life. And I think that I definitely heard that in multiple different spaces throughout the course of today's conversation. And overall, Matt, I'm very, very much just looking forward to staying connected with you and seeing where your career goes. And hopefully it goes very similarly. And you seem like a very intentional person. I'm almost sure that it will, to what you were just talking about, where you end up in academia and your passion clearly for teaching and mentorship and leaving a long-lasting impact on the field is very present. So if people want to stay connected with you, reach out, maybe talk about something that popped up today, where's the best place for them to do that?
Yeah, Josh, I just want to say too, thank you again for this opportunity. And again, for just taking the time to invest in our company to come out to Kentucky and put on an outstanding course. And again, anyone that asks, I would highly recommend it. And if anyone wants more, candid feedback, they can contact me via email is probably the best. My personal email. That's M as in Matt, B as in boy. My last name, Williams, C as in cat, C as in cat @gmail.com. And then I'm also on Instagram. My handle is @M as in Matt, B as in boy, Will 1. I try to be pretty intentional with responding to people in a timely manner. I'm not always the best because I do have a couple of other hats that I wear, which we didn't really unpack, and now's not the time or the place for that. But again, just thank you for this opportunity. Thank you for being willing to invest in our company. And I really honor and appreciate what you've done with R2P and just the way you guys are leading from the front in our profession. Again, I think you are one of the leading pioneers right now in seeing the way things are trending and just part of that hope that I have for the way the profession's headed.
Matt, appreciate that very much. And hopefully next year, when we come back out to Kentucky again, that'll be part of my agenda, and we can make sure that we meet in person. But nonetheless, let's stay connected. I appreciate all of your time today. And like I said, again, just look forward to a developing relationship in the future to come.
Thanks again, man. Take care.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.